I'm Hind. I'm a mother. I'm a wife. I'm also pursuing my career as a pharmacist, and I volunteer with Doctor of the World. Yeah. I volunteer because I want to help people, especially undocumented immigrants, to access GP, to have an appointment with their doctor. That's why I work like a caseworker at Doctor of the World. People deserve to have an appointment, whatever their circumstances, whatever their background, they need to have access to medical service. That's the first thing I want to say. And as myself, I was undocumented immigrant before when I was pregnant, and I had very painful, very terrifying, and very stressful moment when I had my child. And I don't want to see mother to be stressful, to not be able to breastfeed their child. That's why we need to stand hand by hand with support of Doctor of the World, just to make our voice as much as loud to stop and prevent huge hospital bills.
Working with refugees, LGBT asylum seekers and refugees. And it's been a wonderful response to see people want to know, people want to hear, people want to understand where the causes of asylum seeking, causes of where the kind of journey refugees take. If you deny people access to health care because of where they come from, because of their immigration status, then we lose the meaning of great values of this country.
One of our work, we provide health services to migrant domestic workers, help them with registering with GPs. But because of the current situation of migrant domestic workers, their inability to renew the visa make it harder for our work to help them. That's why we need Doctors of the World to provide these services for us. And it's been working for the last 2.5 years. But also this particular vulnerability is not just because they are hidden and isolated in private household, but also because of the policies, the hostile environment policies that the government has been implementing.
The advocacy at political level at the European Union is extremely hard. We have more than 30,000 of lobbyists in Brussels. But what misses is the support of the public. Bridging the needs of undocumented migrants, refugees, asylum seekers to my very own need and all my co-citizens' needs in a way that it will reinforce the healthcare system. This is where we have to be much more convincing.
how the combination of an advocacy strategy at a regional level, working within the regions, within the autonomous communities, and at a national level has proven to be successful, while backed up at the same time with an advocacy at an international level within the UN and working with the review mechanisms in which Spain was taking part. All this combination of elements has proven to be relatively successful in achieving a legal change that has enabled us to regain a little bit of what was lost in 2012 with the regression of rights of the right to health of undocumented migrants that took place in that year.
In Norway we have a very welfare state for those who are insured or within it, but undocumented migrants, they don't have the access to healthcare, and they need it. I think it's really important to work on advocacy on the local level, because they are the people who also see the issues in the cities and they face the problems.
We are aiming to promote improved access for vulnerable groups to primary care. Everybody in the UK is able to access a GP and consultations with a GP. Unfortunately, they're often excluded because they lack the documentation that most surgeries ask for. Either they haven't got ID documents of an acceptable standard, or they don't have the very high standard of proof of address. Many practices are already offering this access, and we want to recognise that. What's been refreshing is, as soon as people hear about this, they're horrified that they've been putting up barriers to this population, and they're eager to sign up.
We do that by establishing a network of doctors and hospitals in our region, and make an agreement with them that they will agree to treat the patients we send to them anonymously and free of charge if possible. This is basically a solution funded by the state of Thuringia to allow people to anonymously consult doctors and hospitals in their region to have access to medical care.
What we see is that partnerships, international partnerships, can drive change by giving national level, local level actors the tools that they need in terms of evidence, in terms of standards, and in terms of the power that comes from working in coalitions to really drive changes in policy and practice in their own particular context.
At the beginning of last year, the UK government made it public that they were using information from NHS patient records to try and track down undocumented migrant patients to support their immigration enforcement work. At our clinic in London, we were no longer able to reassure our patients that they were safe to access primary care without the risk of them being reported to the Home Office and possibly even put in detention and returned to an unsafe country. So as an organisation, we felt we had to do something about this. We worked in partnership with a range of other organisations, patient groups and campaigning organisations to challenge this policy and to force government to properly scrutinise and think about the implications that sharing patient information in this way had for the patients involved, but also for broader society, and particularly in terms of public health.
So we had the patient